Hello, everyone, and welcome. We're so glad you're here with us today. Today, we're talking about a subject near and dear to my heart, literally. Heart health is something that affects each and every one of us, and it's crucial that we understand how to take care of it. We're diving deep into the 6 heart health mistakes women must avoid. These mistakes are more common than you might think, and they can have serious consequences if not addressed. You know, for years, heart disease was considered a man's disease, but we now know that it's the leading cause of death for both men and women in the United States. This misconception has led to a lack of awareness and prevention among women. Ladies, we need to be proactive about our heart health. Regular exercise, a balanced diet, and routine checkups are just a few ways we can stay on top of our heart health. We can't afford to ignore the warning signs or put our health on the back burner. Symptoms of heart disease in women can be different from those in men, and they can often be subtle or mistaken for other conditions. It's time to take charge and make informed decisions that will keep our tickers ticking strong for years to come. This means understanding the risk factors, recognizing the symptoms, and making lifestyle changes that promote heart health. Over the next few chapters, we'll uncover some common mistakes that women often make when it comes to their heart health. These mistakes can range from neglecting regular checkups to underestimating the impact of stress on the heart. We'll talk about why these mistakes are so dangerous and, most importantly, what you can do to avoid them. Knowledge is power, and by being informed, you can take the necessary steps to protect your heart. So whether you're just starting your journey to a healthier heart or you're looking for ways to stay on track, stick around. We'll provide you with practical tips and advice that you can incorporate into your daily life. I promise you, this information could save your life or the life of a woman you love. Let's get started. Together, we can make heart health a priority and ensure that we live long, healthy lives. Thank you for joining us on this important journey. Ladies, we've all been there, feeling a little off, a bit of discomfort, maybe some chest pain. It's easy to brush it off, blame it on stress, indigestion, or even a too tight bra. But here's the thing, your body is constantly communicating with you, and those seemingly minor aches and pains, they could be your heart's way of crying out for help. We often think of heart attacks as sudden and intense, but the truth is, many women experience subtle warning signs weeks or even months in advance. These signs can be easily dismissed, but ignoring them can have dire consequences. That's why it's crucial to pay attention to your body and learn to recognize the often subtle signs of heart trouble. We're talking about jaw pain, shoulder discomfort, shortness of breath, unusual fatigue, flu-like symptoms, or even nausea. These can all be indicators of an underlying heart issue. Remember, you know your body best. If something feels off, don't hesitate to reach out to your doctor. Early detection is key when it comes to heart health, and getting checked out promptly can make all the difference. We check the tire pressure in our cars, the batteries in our smoke detectors, but how many of us actually know our critical health numbers? Ladies, this is vital information. Just like those other essential checks, knowing your numbers can literally save your life. We're talking about 4 key numbers: blood pressure, cholesterol, blood sugar, and body mass index, BMI. These numbers provide a snapshot of your overall health and can help identify potential risk factors for heart disease. Starting in your 20s, make it a habit to get these numbers checked regularly. Your doctor can perform these simple tests during your annual checkup. Knowing your numbers empowers you to take control of your health and make informed decisions. Remember, knowledge is power, and when it comes to your heart, being informed is one of the best things you can do for yourself. We all know family history plays a role in our health. But when it comes to your heart, it's not just about your genes. It's about understanding the patterns, the stories, and the warning signs that might be hidden within your family tree.
You see, heart disease can cast a long shadow. What happened to your parents, grandparents, or even aunts and uncles can provide crucial insights into your own risk factors. We're not just talking about heart attacks here. Think about strokes, heart rhythm problems, even those who needed stents or bypass surgery. These are all pieces of the puzzle that can help us predict and prevent heart problems down the line.
Knowledge is power, and knowing your family's heart health history is empowering. It's time to start those conversations, to ask the questions and gather the information that could be life-saving. Remember, this isn't just about you. It's about protecting yourself and future generations. Let's talk about a dangerous misconception I hear all too often. Heart disease? That won't happen to me. I'm healthy. I hate to break it to you, but heart disease doesn't discriminate. It doesn't care if you're young or old, fit or not, a smoker or a health nut. It can affect anyone, and that's why it's the leading cause of death for both men and women. Now, I'm not saying this to scare you, but to empower you. Just because you lead a healthy lifestyle doesn't make you invincible. It's about understanding that heart disease is a complex interplay of genetics, lifestyle, and sometimes just plain bad luck. You see, even if your arteries are squeaky clean, there are other heart conditions lurking in the shadows. Conditions like heart valve problems, aortic aneurysms, or irregular heart rhythms can strike anyone, regardless of their cholesterol levels. And let's not forget about cardiomyopathies, diseases that affect the heart muscle itself. These conditions can weaken the heart's ability to pump blood effectively, leading to a whole host of problems. The bottom line is this: don't assume you're off the hook just because you don't fit the stereotypical image of someone with heart disease. Many people think that heart disease is something that only affects older individuals or those who are visibly unhealthy. But the reality is far more complex. Even young athletes who seem to be in peak physical condition can be at risk. Sometimes it's a matter of genetics or an undiagnosed condition that can lead to serious heart issues. Education and awareness are crucial. Understanding the risk factors and the signs of heart disease can make a significant difference in early detection and treatment. Regular checkups and screenings are essential, even if you feel perfectly healthy. These can help catch potential problems before they become serious. Lifestyle changes can also play a significant role in heart health. Eating a balanced diet, exercising regularly, and avoiding smoking can all contribute to a healthier heart. Stress management is another important factor. Chronic stress can have a negative impact on your heart, so finding ways to relax and unwind is crucial. Sharing stories and experiences can also help break down misconceptions. When people hear about others who have faced heart disease, it can make the risk feel more real and immediate. Community support and resources are invaluable. Many organizations offer free or low-cost screenings, educational materials, and support groups for those affected by heart disease. Knowing your family health history is also important. If heart disease runs in your family, you may be at a higher risk, and taking preventive measures becomes even more critical. Remember, heart disease doesn't have to be a death sentence. With the right knowledge, lifestyle changes, and medical care, many people live long, healthy lives despite their diagnosis. Advocacy and awareness can lead to better funding for research, more comprehensive healthcare policies, and ultimately, better outcomes for everyone. So let's work together to spread the word and support each other in the journey towards better heart health. No one is immune, but everyone can take steps to protect their heart. By staying informed, getting regular checkups, and making heart-healthy choices, we can all contribute to a healthier future for ourselves and our loved ones. Remember, heart health is a lifelong journey. Let's take it one step at a time together. We all know stress is a part of life, but did you know it can actually impact your heart health? You see, when you're stressed, your body goes into fight or flight mode, your heart races, your blood pressure spikes, and over time, this can really take a toll. It's like constantly revving your car engine. Eventually, something's gotta give. That's why managing stress is so crucial for a healthy heart. And it's not just about avoiding stress altogether. It's about finding healthy ways to cope.
Stress-busting strategies for a healthy heart.
We all know a good night's sleep is essential for feeling our best. But did you know it's also crucial for a healthy heart? Sleep is not just a time for rest. It's a critical period for your body to perform essential maintenance tasks. You see, while you sleep, your body is hard at work repairing and rejuvenating itself. This includes your heart. During deep sleep stages, your heart rate slows down and your blood pressure drops, giving your heart a much-needed break. This period of rest is vital for maintaining cardiovascular health. When you don't get enough sleep, it disrupts these vital processes, putting extra strain on your heart. Lack of sleep can lead to increased stress hormones like cortisol, which can cause inflammation and damage to your blood vessels. And over time, chronic sleep deprivation can increase your risk of heart disease, high blood pressure, and even stroke. Studies have shown that people who consistently get less than 6 hours of sleep per night are at a higher risk for these conditions.
The dangers of sleep deprivation.
Now, you might think you can get away with just a few hours of sleep here and there, but trust me, your body knows the difference. Even if you feel fine, your heart and other organs are silently suffering. Studies have shown that even one night of poor sleep can negatively impact your blood pressure, heart rate, and blood sugar levels. These changes can set the stage for more serious health issues if poor sleep becomes a habit. And if you have a sleep disorder like sleep apnea, it can further disrupt your sleep and put you at even greater risk for heart problems. Sleep apnea is a condition where your breathing repeatedly stops and starts during sleep, leading to fragmented sleep and reduced oxygen levels in your blood. Sleep apnea causes you to repeatedly stop breathing throughout the night, which puts stress on your heart and can lead to high blood pressure and irregular heart rhythms. This constant strain can weaken your heart over time, making it less efficient at pumping blood.
Prioritizing sleep for a healthy heart.
So how much sleep do you really need? The answer varies slightly from person to person, but there are general guidelines to follow. Most adults need around 7 to 8 hours of quality sleep each night. This amount allows your body to go through all the necessary sleep cycles, including deep sleep and REM sleep, which are crucial for physical and mental health. And it's not just about the quantity, but the quality of your sleep that matters. Poor quality sleep can be just as harmful as not getting enough sleep. Factors like noise, light, and even your mattress can affect how well you sleep. That means creating a relaxing bedtime routine and making sure your bedroom is conducive to sleep. Consider activities like reading a book, taking a warm bath, or practicing mindfulness to help you wind down. Keep your bedroom cool, dark, and quiet, and avoid screens for at least an hour before bed. The blue light emitted by phones, tablets, and computers can interfere with your body's natural sleep-wake cycle. If you're having trouble sleeping, talk to your doctor. They can help you identify any underlying sleep disorders and recommend strategies to improve your sleep habits. Sometimes, simple lifestyle changes can make a big difference. They can help you identify any underlying sleep disorders and recommend strategies to improve your sleep habits. In some cases, you might need a sleep study to diagnose conditions like sleep apnea, which can then be treated with lifestyle changes, medical devices, or even surgery. Practicing good sleep hygiene is essential. This includes going to bed and waking up at the same time every day, even on weekends. Consistency helps regulate your body's internal clock, making it easier to fall asleep and wake up naturally. Avoid caffeine and heavy meals close to bedtime. Both can interfere with your ability to fall asleep and stay asleep. Instead, opt for a light snack if you're hungry and try to finish eating at least 2 hours before bed. Regular physical activity can also promote better sleep. Aim for at least 30 minutes of moderate exercise most days of the week, but try to avoid vigorous workouts close to bedtime as they can be stimulating. Managing stress is another crucial aspect of good sleep hygiene. Techniques like deep breathing, meditation, and yoga can help calm your mind and prepare your body for sleep. Chronic stress can keep you awake at night, so finding ways to relax is essential. Creating a sleep-friendly environment can make a big difference. Consider using blackout curtains to block out light and a white noise machine to drown out any disruptive sounds. The goal is to create a sanctuary for sleep. Tracking your sleep patterns can also be helpful. Use a sleep journal or a sleep tracking app to monitor how much sleep you're getting and how you feel during the day. This can help you identify patterns and make necessary adjustments. Remember, prioritizing sleep is not just about feeling rested, it's about protecting your heart and overall health. By making sleep a priority, you're taking an important step towards a healthier, happier life. Combine good sleep habits with a balanced diet and regular exercise for the best results. A holistic approach to health will ensure that your heart and body are in the best shape possible. And always consult with your healthcare provider if you have any concerns about your sleep or heart health. They can provide personalized advice and support to help you achieve your health goals. So tonight, make a commitment to prioritize your sleep. Your heart will thank you for it. So there you have it, ladies. 6 heart health mistakes you need to avoid. Remember, taking care of your heart is one of the most important things you can do for yourself. By making healthy choices, managing stress, and prioritizing sleep, you can keep your heart healthy and strong for years to come. Now, I want to hear from you. What steps are you taking to protect your heart health? Share your tips and experiences in the comments below. And don't forget to like this video, subscribe to our channel for more health advice, and share this important information with your friends and family. Until next time, stay healthy.